Thank you, Dr. Jernigan. Would the speakers come up to, and this saved the one on the end for me because unfortunately I have to go out to teach. So I will be leaving before the panel is over, but just want to thank everyone for having me. Put the mics on and turn them on.
Check.
So when we met last week and I looked at the agenda, there was something on the agenda that I had not expected, and that was for me to talk for 15 minutes. And poor Meredith, when we got off the phone, I said, I was not prepared to talk for 15 minutes. Well, I have enough notes to talk for 20, but don't worry about it since I have to leave. But I just want to offer some few comments on some of the things that I heard in this panel, and I just want to thank everyone for emphasizing the importance of history, because sometimes I have to stand up and say that. And in the first presentation, we got to hear about the law. And one of the things that I think is critical that when we think about the law, it's not just federal laws that they're in terms of civil rights. And my eye went to the law that you talk about, the Indian Citizenship Act of 1924. And 1924 stuck out for me for two other reasons. One, that was the passage of the Virginia Racial Integrity Act. And the Virginia Racial Integrity Act basically banned the marriage between black and white people. That if you did not put someone's race on a birth certificate and it was incorrect, that you could go to jail. But it also defined who could be Native American, who could be Indian. So that is like a law that we don't think about in terms of who is a citizen. And also in 1924, there was one of the Immigration Acts, which defined who could be a citizen. It excluded the Japanese as being able to be naturalized. It also had a quota for the Chinese, so that the importance of history, that it's not, we don't think about some of these acts and laws in terms of healthcare, but I think it's really important. And Siobhan, in your presentation, one of the most important things I learned about you is that you're from Camden.
It's an amazing thing.
Well, I'm from Philly, and I'm from Philly, and some of you might have certain images of Camden, but I remember when people from Philadelphia moved to Camden because they thought they were moving on up.
Right.
And the reason why they thought they were moving on up is that there were jobs there. There was RCA Victor, and there was Campbell's Soup. But that historically you see how this community has lost resources, lost jobs, and has a particular image today. And when you showed the chattel slavery, that one of the concepts that the scholar Dana Ramey Berry talks about, she talks about soul value. That that your body might have been commodified for slavery, but there was something that could not be commodified, and that was your soul and your interior life. And I think that is a theme that goes through all of these presentations in terms of the strengths of people, in terms of looking at it, not just looking at Camden as a disadvantaged place, but a place which has communities and people take care of each other. And the other thing that I think has come across in these presentations is the importance of lived experiences. That the story of people. And Siobhan, you told me that you were going to say tell a personal story, and I did not know what it was, but the story of your relative not getting care, and I was very happy. I did not have to come up and say Charles Drew got health care. But the thing is, Charles Drew might have gotten health care,
right,
but there were other people that did not get healthcare, and that's why the myth of his death continues to resonate. And Ruth, in your presentation, you once again also emphasized the importance of history, the importance of this imperial history. But the other thing that I think that was important in your presentation is that you talk about how these groups have their histories have been erased. That it's not like the 3 Mexican countries, I don't know if you saw that on Fox this weekend, the 3 Mexican countries that were going to be denied aid. But that each of these communities, these subgroups, and even the term subgroup, I think is rather problematic, has their own histories. And that in order to address these social determinants in health, we have to be able to know about the histories of these particular groups. And Valerie, one of the things that I, as a historian, I found very compelling in your presentation is that you showed specifically how history has adversely affected the health of Native people. Talking about how this disruption of Native peoples from their environment, and how with this removal and restriction of Native people, resulted in Native people being dependent on a government program for healthcare. But the other thing that you did too at the end is remind us, and I think all the presentations have reminded us of the importance of the resilience of the communities that someone brought up earlier, social capital. And so we also have to realize that a lot of the solutions are in the communities in which we care about. So those are my comments. Since I was going to ask a question, but since we're limited on time, I'll come back to my question if no one else in the audience has a question.
Good morning. Thank you for those great presentations. Jamie Ard, I'm a member. So it strikes me that it sounds like we need to be thinking about these structural changes, making progress and changing laws and policies. That means that we should likely influence that through a political process. That's how laws are generally affected. And so this then leads to the question around the other R word, which we've been hearing a lot about in the news lately because of the Democratic candidates who are throwing their hats in the pool, is reparations. So you've sort of opened this sort of framework of health equity as being a function of these historical inequities and challenges. And the question is, should we be thinking about trying to influence this conversation around reparations? Because no one's really defined what that means, but might we have an opportunity to influence that conversation? Would it be to our advantage to frame it from a health equity standpoint and say this is an opportunity to begin to structurally change some things now that people are starting to talk about this?
That's probably for me. Is it open? Okay. I'll start because I do want to say that I believe reparations is a part of a whole process. For me personally, I don't think reparations will even come close to the effects of the African American experience in this country. but I want all my acres and my mules, and I want everything back that I'm owed, plus more. Because the plus more for me is being able to look at structural changes, being able to look at changing laws, but also looking at political power. In my estimation, individuals that have the ability to make decisions for other communities has always been a challenge, particularly for the Black community. And so what does that mean, reparations? I mean, I believe that there are some fiscal implications. I believe there's some political implications. I believe there are some communities that have received certain reparations that have been documented and others have not. So I am a proponent of it as a part of a solution, but not as the answer to how we change inequity completely, because I don't think it even scratches the surface. That's just a personal response.
Yeah, I agree. I don't think we should distract ourselves with the issue of reparations. I think we have to begin to influence the knowledge producers, like the National Academy of Science, so that they can begin to promote a reversal of structural racism. And I think the solutions are in changing the structure through policies and laws so that we can help those communities to thrive. I think we need universal health care. I think we need universal education that is paid for with our taxes, not by the poor communities. I mean, those would be two great places to start on equity. And I think that employment and health benefits, a living wage, we know the answers. But what I have come to is that at the university, when I get students who are graduating, they really haven't heard about inequality and inequity. I mean, it's amazing to me. At University of Maryland, 20 years, I teach senior seminars, the research capstones. They have not even, and we are in Prince George's County, which is 30-something% African American. They haven't even been taught about race. And I think we have to really begin to educate the US population a little bit more, the professionals, because we're the ones who in part have the political power. And institutions like the National Academy of Science has to be color brave and has to be courageous in its commitment to change the situation that we have overstudied. My point of view.
Valerie, do you want to comment on this issue?
I do, thank you. I wanted to add, I really think that that's a brilliant question, because I do think that using the health angle is what other countries have done and can be very effective. The Close the Gap initiative in Australia, for example, is really focused on truth-telling as a means of moving forward and healing. And so I think that recognizing the huge disparities in mortality is going to be a key way to initiate some of these kinds of truth and reconciliation initiatives that will help to bring a historical perspective into modern day contemporary disparities that we're facing. So I do think we have a responsibility as health leaders to talk about these historical factors and push for truth and reconciliation.
So for those that are seeing this, Dr. Vanessa Gamble has to head to class and teach these students about this work. So let's hear it for her as she walks out of the room. She's got an entire class. She's about to change their lives. You going to take the next question? Or you want? Okay. All right. So we have another question in the audience.
Ukuzawa, I'm a member of the roundtable too. So I'm glad somebody else brought up the reparations question. But in kind of like a research context, since we're at the Academies, one thing that I heard from all of you, I think, was, although you didn't use the word, was maybe a bias or maybe even a white-centeredness in the research to date about disparities and a recognition that what's missing in some of this is, I think especially Valerie brought this up, was allowing peoples themselves to begin to define, what the questions ought to be, and even what ought to be studied and what's valuable in that context. So I'm just wondering, from your point of view, if what you can say about what we need to talk to the research community about, sort of maybe changing our framework if necessary.
So in the end of my presentation, one of the things that I talked about was the researcher's responsibility. And so the context for that is really how we look at community-centered approaches that leads with communities as principal leaders, as principal decision makers, as individuals that actually can help create agendas around research questions. One of the things that we've experienced over the last, I would say 15, 20 years is, you remember when CBPR kind of got really big, community-based participatory research, it became a thing, but its implementation stayed on paper. And what we found was that there are a lot of communities that were brought to the table to hear about the research that was going to be done on them. And people checked the box and thought that was amazing, not understanding that the communities that were being researched actually had other values, actually had other areas that they wanted to have addressed. And so I believe the point is very valid in terms of understanding. Again, this is all about power for me, power dynamics, and understanding who's in power and who's not. Because even as we sit in this room, this is a power dynamic. Well, this is the Academy talking. We're scientists. This is what we do every day. But there is a sense of entitlement in some places in tables that we sit at. And so I think that bringing that question forward is really intuitive, because we are finding ourselves in a situation where communities have very different values. But do those values line up with our funding? Not always. And there has to be a way to allow communities to speak to where resources should be going, and also teaching them their opportunity to have power to speak on where resources should go.
Yeah, I'll jump in quickly, and it's kind of on topic, but a little off. And that's that one of the things that I think the Communities of Health Practice, the other Academy research project came up with, was a really interesting way of looking at kind of a civil rights approach to address things. And really did bring in that idea of, from the start, you need to really be involving the community. We need to describe the program or activity, analyze burdens and benefits for all people, analyze alternatives, include people of color and low-income people in the decision-making process, and implement a plan to address equity concerns and avoid discrimination. A couple of things they also really stress, which I think are what you all are experts at, is really that coming with that information, the data, the analysis to really show what problems we're seeing are really important. So being able to use federal funding or be able to find these data sources that are out there. There's some really great sites that I didn't get to in my slides, but both the EPA and education have these amazing data sets that really talk about local education and environmental laws and policies. They talk about, some of the problems being seen, and that kind of information to bring it to a community and talk about, what are they seeing in their community, and where are they facing these problems and barriers, and how can we address it? I think is something that we all could help with, and also help to think then about the research and the implementation of it.
I just have one comment. I mean, the new word, of course, is community engaged research. But isn't it a form of deception to say to the community, we want to hear your voice, we want you to contribute the questions, and then not really be able to do anything about it?
That's it. Okay, thank you. Good point. We have about 2 minutes, so we have 2 questions here. So we'll do Shariki first, and then we'll close with this question, and then we'll do some housekeeping and talk about lunch.
This is a very specific question for Angie. You didn't get to mention the Fair Housing Act, but to me, from what I understand about it, it's a good example of something that's going to be very hard to repair in terms of its effect on wealth building, home flipping or whatever you call, being able to home ownership. And I wonder if there's any movement to analyze current initiatives in light of the history so that they could more deliberately try to repair some of these things that have just baked in low income status.
I don't know of specific research like that. I think that would be great. I do know that this is an area that the Supreme Court and others really have talked about recently. One thing also that I didn't get to it as much, but all the civil rights laws apply to intentional discrimination. But one of the things that's big is, can we bring disparate impact and discriminatory effect? And I think this is a place where that kind of analysis and data really would show the impact of redlining and mortgage, financing issues in the past, and I think that would be a really interesting way to think about it. But the Supreme Court actually said in 2015 that the Fair Housing Act, they really did think allowed that look at disparate impact, which allows us to do that kind of analysis and hopefully bring it up if it's something that makes a difference.
Our final question.
Thank you, all panelists. I was just wondering, it does seem like this is a community-driven situation, and how would you recommend sort of an innovative way to sort of engage and bring the community abreast of these situations moving forward? I love what Ms. Ruth said earlier, that we have enough of information out there. Maybe we should start thinking moving forward, how do we disseminate this information to engage our communities and keep them informed? And beyond that, I know we're talking policies. I know with situations, policy will be there. We definitely have to address that. But why don't we think of innovative ways to really bring these discussions to the community and sort of have it sort of a creative way, innovative way to bridge the gap? What do you think? What would be your methodologies or your suggestion moving forward?
Great question.
I just have one quick, and I think, we are at a time where we can do kind of innovative things and bring questions to people quickly. I think social media is one way. I think ways to bring people home. We have things like GIS. We have some really interesting mapping tools and data at the local level that I think can help to make that story. And so hopefully bring people in by these new methods, giving new voices, new perspectives out there. I think maybe one way to get some innovation.
I think about this, and the book that Dr. Komuniki and I and Dr. Brennan wrote on obesity interventions has some wonderful programmatic interventions that they have done, like walking, night walking, etc. But when you think about the social determinants and the circumstances of individuals in our communities who may work 2 and 3 jobs, who are domestic workers, who are tired when they get home, and who may have to prioritize different obligations, like maybe going to the school for the child. So when we ask them for additional participation, it is just another burden, and it's very hard to get these low-income communities moving. As we know, most of the organizing right now, won't mention any names, but are being done by upper middle class, middle class people. They have more time, they have money, they need to eat out, etc. So I think that's a hard stretch. We've tried that. The 1960s, we tried that. For some of the voting rights in the past election, we did have mainly professionals going out to low-income communities to increase the vote. But I think it's a hard ask for a community that is already overburdened and stressed, without benefits, without childcare, with poor housing, to ask them to also engage in a process of change. I really do believe that's our job. With them.
I'm going to do a both and, because I do think that these same communities that we're assuming may be overburdened are also very astute about what's happening. And I think that there is sometimes we make assumptions that we're adding burdens when in fact we need to be offering opportunities, because they have a lot to give and a lot that they want to give but have never been asked. So I think that there's both sides to the coin. How do you stay away from burden, but also how do you create space? And so are we going to communities where they are? Are we speaking to faith communities? Are we speaking to civic organizations? Are we talking to families about what's happening to them? As a mother of a 5-year-old, put something in the school notice for me, I'm on it. I get that text message from his school, I'm out. I'm leaving here and I'm going straight to the school, because that's what I value. If we put messages in places where people value, I think we will get a response. And I will say our current political climate is also, we need to leverage this climate, because the things that we're seeing around our country, they affect everyone. And I will tell you that there are conversations in every community, I would assume, that would want to be engaged. And I want to make sure we get Valerie, any thoughts on that before we close out?
I think it's related to what I presented about around having interventions, but also having participation happen in a way that's organic. Yeah. And our focus is that you never go into a community and take something. You're always giving something, and it's about the relationships. And so I find in my work that despite having, being overcommitted and having lots of other priorities, that if we're working together on something meaningful that we truly deeply believe in, that people will share the responsibility to engage together if it's something that's really important and has heart to it.
Valerie, thank you. Thank you all so much. Let's thank all of our speakers. Valerie, you're awesome. Our panelists here. Stay on time. It's about 12:06, and so it is now time for lunch. For those that are here attending, please direct your attention to the staff who can guide you to the cafeteria. If you are a roundtable member, if you are a workshop speaker or a workshop planning committee member, you need to meet in the West Court. We'll be gathering for a conversation in the West Court. For others that are just in attendance, please grab some food, but please come back because there's more to come. We'll start promptly at 1 o'clock, and for those that are watching online, take your break too, but log back on at 1 o'clock. All right? Thank you so much, everyone.